Good afternoon. My name's Debbie Mayberry. I am making this video at the urging of many of my friends and fellow sufferers of pharmaceutical injury. This is a message to the makers of Legal Death and Drugs We Trust, Tim and Karen Alexander. Please excuse me, this video may have some shakiness because I will have to do pauses. I am suffering from severe allergies, and I have to be outside because it's cooler than my little tiny RV that has no air conditioning, is sitting in the sun. So that's where this is. So if I have to have a coughing spell or something like that, I'll probably shut the video off and restart it. So I'm just going to say that as a disclaimer. I usually try to make very still videos, but I can't do it this time. So I agreed, based on being presented with doing a movie docuseries on the harms and dangers of benzodiazepines and psychotropics like antidepressants and antipsychotics a number of months ago. I believe it was in April. I read about this being made in some of the benzo groups. I am a proponent of bringing awareness for iatrogenic illnesses, and so I thought this was going to be a good thing. I did a little bit of reading about what was being put out there, and the base of it was they were just going to share our stories about the harms done by psychotropic drugs, antidepressants, antipsychotics, benzodiazepines, opiates. This film has become a farce. First of all, there has been discrediting of true conditions like fibromyalgia and PTSD. The conditions often did come first. They did. Before meds. Often meds exacerbated them, but many people have true conditions that need treatment. It may not be meds for life. It may not be meds at all. But treatment is needed for conditions like PTSD, like fibromyalgia. You don't just let people suffer or tell them it's all in their head and they got it from the drug. That is such a disservice to sick and injured and already troubled people. You are not using true medical science at all. You have no in-depth knowledge of these conditions. I am a nurse. I worked in a busy cardiac center in Eugene, Oregon. I do have knowledge, as well as I do have those conditions. And I find it very rude of you to say they aren't real. I had fibromyalgia pain starting when I was 7 years old. I have PTSD, complex PTSD, from traumas I have endured throughout my lifetime. I do need treatment. I have had wonderful treatment. I have had pain clinic treatment, no medications. I've had cognitive behavior therapy. I've had acceptance and commitment therapy. I've had dialectical behavior therapy. I do meditation. I have to treat my conditions. And for you to say they are not real, well, sir, I call bullshit. Your lack of medical knowledge and you putting your spin on it, this isn't a part of my story, and I'm offended. I'm very offended. The doctors do enough with that for those of us with benzo withdrawal syndrome. I don't need to hear you discounting the reality of my health. As far as your slogan of Dibby, I thought that was pretty good, because we do need to bring awareness, and those kind of things do. The song, not so much. But when you say medications heal, drugs kill, you don't know what you're talking about. First of all, drugs and medications are the same thing. They're the same thing. Whether you get your oxycodone on the street or you get your oxycodone from your doctor, it's a drug or it's a medication. It's interchanged. You can't say one is one and one is the other. You're perpetuating the shame issue by doing that. All medications do not heal. Insulin does not heal. Insulin keeps a diabetic patient's blood sugars in check, but it never heals the diabetes. Sir, you do not know what you're talking about. You do not know what you speak of. And you are making us, I fear, look like we don't know what we're talking about. I've also watched your high-end living of eating lobster and, visiting all these cool places. And wow, that's really great. There's many of us like myself who have lived in a tent, who barely can scrape together enough to get a meal. That's kind of a slap in the face. It really is. I am afraid what this film will do for our plight. The extremism, inaccurate medical statements, and crazy far-reaching agendas will do more damage for our plight than good, adding to the misconception that we're crazy, that we need medications. You sound crazy. My last straw was when you tossed a fellow benzo victim under the bus when he legally is unable to speak at all in his defense. Shame on you. Shame on you. This is not what I signed up for. What worries me is you have very poor judgment of people's feelings at all. People that are sick and injured. And you have a little bit too high of self-esteem. I and many others want our releases back. Elise wants her fund for all of us that are suffering back. That's what that $60,000 was for that she gave you when she was ill, and you pressured her and did not let her get the legal documentation, and you really pulled the wool over her eyes. Shame on you. If you do as we ask, anyone who shares this video, anyone who says they want their release back, if you do that and give Elise her money back, then you can continue on your merry way with whomever still wants into your film. This isn't about politically correct or not. This is about ethics. You have not been ethical of your representation using our agenda that you were supposed to be representing. You are representing yourself, sir. So I urge you to do the right thing, to do the honorable thing. You represent yourself all over in social media as a Christian man. This is not how Christian men that I know behave. Do the right thing. If not, then when the film comes out, there will be a very large group of suffering people who have healed, who will come together to discredit you completely. Trust us. We are warriors. We are warriors. And you have done us a complete disservice. If you agree with this, I ask you to share it. I know it's not my best video. I've been very ill with my allergies. I've been in bed for days. I am not in a good mood. I don't feel well. And I am almost at 2 years from when I jumped off benzos. And it's almost W bad. And that's my focus right now. But I guarantee this, once I get past W bad, this will be my top agenda. I promise. Sending much love to my friends. And I'm sorry for those of you that tried to warn me. I have this problem of believing some of the worst people. I'm trying to heal from it. But I haven't got there yet, evidently. Thank you. Peace.